My name is Diana Yeh, and I'm a senior lecturer here at City, and I'll be co-chairing the event with my colleague Lisa Schuster, also from City. So today's event comes almost exactly 6 months after China first alerted the World Health Organization to a cluster of pneumonia cases of unknown cause. Despite the US and Europe's lack of response, constructing the coronavirus, as it was then known, as a crisis happening over there to a backward other, the disproportionate impact of the pandemic on racialized minorities was almost immediate. So months before Trump's Chinese virus tweet, its racialization had already sparked a rise in racial attacks on Asian diasporas globally. Since then, as we know, racialized migrants and minorities in Europe and the US have experienced a staggeringly higher proportion of rates of infection and deaths, in the UK making up over 90% of doctors who've died. The unequal impact has also been felt in the loss of jobs and income and disproportionate targeting by police under new laws to enforce social distancing. There have also been new Islamophobic and anti-Semitic conspiracy theories about the origins of the virus, increased racial attacks on a range of other minority and migrant groups, and of course, a failure, or if not a refusal, of governments to acknowledge, let alone tackle, these and other injustices, such as the impact of the virus on those incarcerated in border camps, prisons, and state detention centres. So today, as we consider the racialized dimensions of COVID-19, we of course do so under the long shadow cast by the brutal murder of George Floyd and so many others before and after him. So how should we understand and what can we learn from this present conjuncture, both from the racial injustices thrown into sharp relief by COVID-19 and their intersection with Floyd's death and the new global outrage at systemic racial violence that it has sparked? So to think through these issues, we are joined by a truly stellar panel of speakers: Mathiangay Sirleaf, Gargi Bhattacharya, Neera Yuval Davis, Sivamohan Valavan, Vivian Shaw, and Colin Clark, whom I'll introduce at greater length in a moment. But before I do so, I'd now like to hand over to Lisa Schuster, who will be outlining the format of today's event and providing you with some technical details about how to participate. Lisa.
Thank you very much, Diana. And I'd like to welcome the now almost 200 participants who have joined us. As we have quite a lot of attendees and we're expecting very many more, you'll find that your camera and audio are muted, but of course you'll be able to see and hear the speakers. However, we do of course want your participation, your active participation in this event. And so we would ask you to please pose questions to us in the question and answer facility that you should have in your application. When you pose a question, if you wish it to be addressed to a specific panelist, please note that as you write your question. Once each of the panelists have spoken, and each panelist will speak for about 10 minutes, we will have a 5-minute break so that you can get yourself a cup of tea, go to the bathroom, and then we will ask you to come back. At that point, Diana and I will together pose your questions to our panelists, who will address your questions and also comment on the presentations of the other panelists. I hope that's clear, and I'm going to hand back to Diana now, who will introduce our first speaker. Many thanks.
Thanks, Lisa. Okay, so our first speaker, who I'm delighted to introduce, is Mathiangay Sirleaf, who is currently at the University of Pittsburgh, but will be joining the University of Maryland as a professor of law as of tomorrow. So many congratulations, Mathiangay. So Mathiangay is a critical voice in global public health law, and she will be exploring COVID-19 and the racialization of diseases and examine international responsibility in the context of pandemics. Mathiangay.
Thank you so much for that incredibly kind and generous introduction, Diana. I'm really excited to be part of this conversation, and I look forward to learning from my co-panelist. And I have the distinct pleasure of starting off this conversation, and I think that you teed up things quite nicely. And so I want to take up a couple of threads that you brought up. And so the first thing I want to discuss is just the current disparities that we see with COVID-19, and in particular, as I'm situated in the US. Some of my examples will be focused on the devastating impact that COVID-19 is having, especially on Black and Brown communities in the United States. A recent study from the Harvard Center for Population and Development Studies reveals that racial disparities are even worse than the preliminary data indicated. In fact, Black and Latinx communities have COVID-19 mortality rates as much as 9 times higher than white people in the United States. And that is despite the fact that the white population makes up 3 to 4 times a bigger population than that which exists amongst Black and Latinx communities. And this is when you take age into account. And so we've seen a really distressingly high ratios of mortality among younger adults from 24 to 54 years old. And so these health disparities have been contextualized mainly from the point of comorbidities or pre-existing health conditions, that is pointing to things like hypertension or diabetes or obesity or just a higher prevalence of cardiovascular disease amongst Black communities or Latinx communities. As a way for trying to explain the fact that when Black and Latinx communities have COVID-19, they tend to suffer greater and more severe complications, including death. But the term to comorbidities, I think, belies a bigger structural issue in that it's not that one group of people has evolved to have a genetic predisposition to heart failure or hypertension or infant mortality or diabetes or asthma or what have you, all of which underlying conditions exacerbate COVID-19. In fact, of course, there's no evolutionary theory that can help to explain why, say, for example, African ancestry would be genetically prone to a very common illness. And so instead of it being the constitution of Black or brown people that is problematic or deadly, it's more about society that has been organized pathologically, historically, and this continues to be the case. And so this helps to contextualize the adverse health outcomes we see with COVID-19 in Black and brown communities, especially by pointing attention to the structural factors, whereas these communities are more likely to encounter bias when they try to access the health systems. They are more likely to be in communities that are violent, that are polluted. They are more likely to be hit with unemployment, in hazardous and unsafe jobs, and with inadequate support systems. And I think the COVID-19 pandemic has exposed quite dramatically this underlying racial hierarchy that exists in the United States, but that we also see in other racialized societies in the UK and elsewhere. And the ways in which countries have tried to prevent the spread of COVID-19 also plays on that racial hierarchy, because stay-at-home orders presume the privilege and ability to maintain social distancing, which may be impossible for a number of people who are living in potted dwellings or in densely populated areas. People might have to rely on public transportation and the like to get around, all of which heightens your risk of exposure. And so the concept of racial capitalism here is instructive because it helps to contextualize and illuminate how being a thing of importance is something that is a functional relationship between dominant and subordinated groups. And so those with higher incomes are more able to follow social distancing guidelines, while working class and lower income individuals are not. These quote unquote essential workers are disproportionately poor people of color. For example, Black workers are about 1 in 9 workers overall in the United States. They make up 1 in 6 of all frontline industry workers. And these essential workers tend to face more risk from keeping societies functioning during the pandemic. So these are our transportation workers, our sanitation workers, our grocery store, convenience and drugstore clerks, as well as other people employed in public-facing jobs. And they are doing this at the same time that they are facing great economic insecurity during a pandemic that's registering higher rates amongst their communities. And so I want to talk about those racial disparities, and then I want to contextualize them against the background of the racialization of diseases. As Diana pointed out in her introduction, the COVID-19 pandemic has really just surfaced what was always latently there, and that is the stigmatizing of people of color as diseased. And we have seen this in medical journals, say there's a 1915 article in the Southern Medical Journal that states that Black people are a hive of dangerous germs, perhaps the greatest disease spreader among other subspecies of Homo sapiens. And we've seen racial hierarchies throughout history based in part on the racialization of diseases being replicated through systems like slavery and colonialism and the like. In the United States, for example, Black people were considered a notoriously syphilis-soaked race, while white people were purportedly, only suffering from polio because of their complex and delicate bodies. As we've also seen the ways in which scientific racism has sort of legitimized explicit and implicit pseudoscientific distinctions that dehumanize, devalue, and denigrate the work of Black, Indigenous, and other people of color. And so in South Africa, this surfaced with those that have leprosy being perceived as, since leprosy was considered a Black disease, harsher measures were enacted to allow for compulsory segregation of Black lepers, whereas those that were experiencing leprosy that were white, they were allowed to be quarantined at home. And so we've seen the racialization of diseases continue, and we don't have to go as far back as I just went. For example, with the H1N1 novel influenza virus in 2009 in the United States, there was an attempt by some to try to identify what the foreign source of the disease was. A few commentators blame Mexican immigrants and illegals for bringing the virus across the border. When the mad cow disease took place in the UK, there wasn't a similar racist or ethnic tinge or backlash to understanding that disease. And so despite the fact that disease-carrying microorganisms do not differentiate at all amongst their victims based on race, nationality, ethnicity, or other categories, institutions, laws, policies, and individuals and other actors definitely do. And so the racialization of diseases is important because it helps to understand the current moment with COVID-19 and the ways in which racialized fears of contagion have contributed to the development of the global public health regime. And one of the things that is important to think about is the ways in which the global public health regime evolved internationally was coterminous with European imperial expansion. And so colonial powers increased their international cooperation with other imperial powers for the containment of diseases in order to perfect the expansion of empire and to secure trade routes. And so, for example, between 1851 and 1873, European powers negotiated a number of different international treaties relating to disease prevention and control. Although none were enacted, this is early evidence of the importance that was placed on global public health. Eventually, colonial powers concluded treaties aimed at determining how restrictive quarantine regulations needed to be in order to continue the expansion of imperial trade. And this effort at international cooperation needs to be contextualized against the background of British colonials, for example, in 1793, giving Lenape emissaries items from a smallpox infirmary to intentionally spread diseases to nearby indigenous people. And so the incongruity of the settler colonial project spreading diseases that decimated native and indigenous populations while European colonial powers formulated treaties aimed at protecting their metropoles is telling. And so understood against this background, European imperial powers, early efforts at global health cooperation were inherently racialized. And so the first International Sanitary Conference was convened, and that conference focused on addressing the danger of cholera, which posed a particular threat to Europe at that time. It sparked significant fear because having reached Russia from India, there was a concern that cholera would spread and it would impact a number of colonial centers. And so the 1892 convention only addresses cholera and the westbound shipping of goods to European countries based on fears that the Suez Canal might be a conduit for importation of cholera from India. And so this pattern is repeated again and again in the early treaties, where the inclusion of a disease as deserving of international recognition and regulation has to coincide with the importance of that disease in Western capitals. And this is not as if diseases prioritized by the early global health treaties were the only diseases that were afflicting populations at that time. The treaties that took place did not take place in a vacuum. They took place against the background of this colonial project. And it wasn't until 1944 that there was a modification of the International Sanitary Convention regimes that began requiring information from other countries to send epidemiological information about communicable diseases, irrespective of whether Western powers had preordained the diseases as significant. And so with the advent of the International Health Regulations of 2005, which is the current treaty that's governing global health, there was an attempt to broaden the nature of surveillance and notification for infectious diseases. In particular, the creation of the World Health Organization gave that body the power to define a public health emergency of international concern, which is defined as an extraordinary event which constitutes a public health risk to other states through the international spread of disease and to potentially require a coordinated international response. But the determination of when a disease constitutes an international emergency is a decision that I submit is informed implicitly by determination of the worth, utility, and importance of the populations impacted and their proximity to Western interests. And so that can also surface explicitly. We saw this in the 2014 and 2015 Ebola epidemic that took place in West Africa, where an unfortunate situation in a backward region, quote unquote, was transformed into a significant public health emergency of international concern, despite the fact that the alarm had been going off for several months, that the situation in the West African subregion was unprecedented. It wasn't until August of 2014 that the World Health Organization declared Ebola a public health emergency of international concern. And it was at this point that international efforts were put forward to try to contain the epidemic. And so the World Health Organization seized on the fact that someone from Liberia who was infected with Ebola was traveling to Nigeria as an opportunity to revise its initial flat-footed stance toward the disease. But the threat of international spread was already present. In fact, the disease had already traveled over 3 borders to upend things in 3 different countries, including Liberia, Sierra Leone, and Guinea. And so the trivial number of cases that were seen with Ebola in Europe and in the United States transformed Ebola into a crisis calling for international attention. And so the Ebola epidemic of 2014 in some ways is important because it resuscitated historical images of Black African bodies as uncontainable, as disease-ridden, and it sparked racialized fears. In part informed by the death of Thomas Eric Duncan, who was the first Ebola case detected in the United States. 2 healthcare workers in Dallas, Texas contracted Ebola from him. And after his arrival, he went to the hospital to seek care. They got sick. He ultimately died. This instance then sparked fear across the United States, with students being taunted as Ebola kids. In Dallas, 2 students from Rwanda were sent home from a New Jersey school, even though Rwanda is 2,600 miles from any country in West Africa. Texas College sent out letters to prospective students from Nigeria, informing them that they were no longer accepting applications from countries with Ebola cases, despite the fact that the World Health Organization had declared Ebola, Nigeria Ebola free. And school principal was even was placed on administrative leave for a week for attending a funeral in Zambia, which again is nowhere near West Africa. Is 2,770 miles away from West Africa. And so I want to contextualize the ways in which Ebola was racialized to what we see now with the COVID-19 pandemic, because there is a way in which the racialized fears of contagion are manifesting with COVID-19. The pandemic has certainly reinvigorated the 19th century strain of thought that maintains that all things Asian are a threat to the Western world. There was a newspaper in France that recently carried the headline "Yellow Alert," quote unquote. As Diana mentioned, the president of this country continues to make geographical references to the disease, even though international organizations have said that this is not a helpful designation. The president refuses to refer to the disease as COVID-19, instead uses slurs like quote unquote the Kung flu and quote unquote the China virus and other things that tend to stigmatize people of Asian descent. People of Asian descent have been physically attacked in cities as disparate as London and in San Fernando. Individuals that present as Asian are being racially profiled. Kids have tried to test, quote unquote, other kids for the coronavirus. And some institutions have tried to normalize this xenophobia and racism as understandable reactions to COVID-19, as opposed to the problematic racism that it is. And this is tied to a history of pathologizing people of Asian descent in the United States in particular, but elsewhere. So for example, when the smallpox epidemic hit San Francisco in 1876, officials there referred to that city's Chinatown as a quote unquote laboratory of infection. The Chinese Exclusion Act was an immigration law that was passed in 1882, prevented Chinese laborers from immigrating to the United States, in part based on biases and stereotypes that they were more likely to carry diseases like cholera and smallpox. And so there's a way in which we see this resurfacing of racism, the blatant racism in the reaction to COVID-19. And so I wanted to talk a little bit about the protest since Diana referenced it in her intro, because I think the reaction to the protest have been quite different. And so I want to contextualize the quote unquote anti-lockdown protests that emerged in the United States to the protests that are happening globally and in the United States for the movement for Black lives. And so as COVID-19 became racialized as Black or Brown in the United States, the disease seemingly registered less and less as requiring an emphatic and corrective response for some. It became increasingly clear that COVID-19 was not a great universal leveler as some predicted, and that it wasn't actually impacting all populations similarly, and that it was having these racially disproportionate impacts. We see anti-lockdown protests emerging in the United States in a way of enforcing the racial valuation of diseases. And so although the lockdown protests and the anti-lockdown protests in the United States took place in very disparate places, a similar theme emerged from most of them. The demonstrators were overwhelmingly white. They were united in their vitriol about COVID-19 mitigation strategies and the public health laws that were passed in a number of states to try to combat COVID-19. They viewed this as an affront to their liberty to consume, as an infringement on their entitlements to white privilege. The anti-lockdown protests were based on either explicitly or implicitly a judgment of whose lives are worth risking during this pandemic. And so Cheryl Harris's work is really instructive here because she talks about how whiteness has been something that has historically been the property of free human beings. And so the lockdown measures then threaten the very essence of identity, freedom, and autonomy for at least some subset of white people in the United States. And so their interest in maintaining the racial hierarchy and status quo through rejection of the lockdown measures, which dared to suggest that harm to the lives of those not regarded as white should in any way control their obligations or movements, their presence and their liberties of those that are considered white, is a clear smack in the face of the racial order as they perceived it. And so then it was not uncommon to see at the anti-lockdown protests heavily armed people with guns, some with Confederate paraphernalia, some with nooses, some with swastikas, as symbol of racial terror and subordination. And so failing to understand the role of race and racism in these anti-lockdown protests would otherwise leave one befuddled and confused about the connection the protesters were making between COVID-19, social distancing laws, and measures and symbols of white supremacy. And in fact, Rebecca Bradley, who is a Supreme Court justice in Wisconsin here, said the quiet part out loud. She compared their state's stay-at-home order to the Japanese internment during World War II, and her comments make evident who is deserving of freedom and autonomy, or who is perceived to be deserving of freedom and autonomy in society. And so there's a way in which the racialization of COVID-19 and the determination that Black and brown lives are worth less is made evident by the way in which the state has responded as well, by prematurely opening up the economy in the United States at the time when this webinar. The national death toll is over 100,000. The country has registered over 2 million cases. Many areas are seeking a return to the status quo, even though the rates of infection are not yet under control. There is not sufficient contact tracing that has been established. Testing capacity has not ramped up sufficiently. Neither a vaccine or treatment is ready for widespread and safe public administration, yet and still you see many areas rushing to open up. And so the tied along with the rush to open up in many areas of the United States cannot be separated from the knowledge about who is detrimentally being impacted.
2 minutes left, Matiange.
Okay.
Thank you.
By this disease. And so it seems like there is an implicit calculus that since the suffering and vulnerability associated with racial health inequities has historically been normalized, why should COVID-19 be treated any differently, and why should it require extraordinary measures from society? And so I want to juxtapose the lockdown protests, anti-lockdown protests, to the uprisings that we see taking place globally, where people are demanding equality and accountability and an end to police brutality and systematic racial injustice. And we've seen the toppling of a number of statutes across the world that reflect a particular racial order, a particular colonial order, and that challenge our understanding of what equality is and what racial justice is. And in particular, I wanted to just quickly point to the ways in which the police have seemed to exercise, at least in the United States, considerable amount of restraint to the anti-lockdown protests, and contrast that to the ways in which state violence has been meted out against those organizing as part of the movement for Black Lives. The state response, which includes brutality, armored vehicles, curfews, tear gas, pepper spray, rubber and wooden bullets, have been nothing short of illuminating, because it evidences what is valued in the society and how people who are organizing for changing the racial status quo are greeted, versus how people who are organizing to maintain the racial status quo are treated by society.
Next speaker, who is Gargi Bhattacharya, Professor of Sociology at the University of East London. And Gargi will speak on the racialized violence of neglect. Thank you, Gargi.
Thanks again for inviting me. So I have this kind of working title of The Racialized Politics of Neglect, Austerity to Pandemic to What Next, which, as you can imagine, is what we're all thinking. Some of if you're based in Britain or even another part of Europe, some of this argument will be so glaringly obvious you don't even need to think about it. If you're based elsewhere, I can't tell how much of it makes sense, because I want to begin with a kind of British stroke European experience of austerity, in which I think austerity in its post-2008 incarnation really worked to establish process of disentitlement, things that people might previously have had a route to access or a way of explaining how they deserved something. That austerity is a way of breaking apart those machineries of ordinary people saying that this is what my humanness or my citizenship or my claim is. And I think they've been extremely effective. Certainly in this country, I think that process has absolutely remade the terms of and the bureaucracy of what the welfare state is, and really I think beyond that of many, many interactions between population and state. What we have in replacing a previous kind of earlier model of welfareism as a kind of distribution, even if it's an unequal distribution, is credentialism. And again, that was going on beforehand, but the 2008 crash and the austerity that followed has really placed credentialism at the centre of how any kind of distributive function of the state seems to be remade as a showing evidence. So we are always constantly now showing our papers, showing how we're not entitled, showing that we are deserving, showing we have a right to be in this space. which is quite, that's a shift in the balance of evidentiary kind of burden. And it's really worked well. It's really worked as a way of extreme rationing of services, a real rolling back of support services, an absolute withdrawal of certain kinds of state support and service from a whole range of people. But again, people who are based in Britain won't be surprised to hear this, but I think it is always worth saying to a more international audience that it's really very, very rapid for food insecurity to become such a widespread national issue in Britain. People were hungry, but that sense that basic hunger, including for children, they think something like a quarter of families with children, one of the adults rations their own food to ensure that children can eat. That's happened very, very quickly. And the rapid escalation of that is partly this process of credentialism and disentitlement. So you kind of institute those logics of scarcity through bureaucratic practice. And so I think that the concept of triage, that even if you're almost at death's door on the road, someone has to come and assess whether it's worth giving you any help or not. That had already entered public consciousness, I think, through those terms of disentitlement and austerity. It's not enough to go around. We can't look after everybody. Actually, not everyone deserves to be looked after, if we ever even believe that. We need to have a new bureaucratic system of saying, like, how can we best use our resources? If you're going to die, just die quickly and quietly. If you're not, maybe I'll save you a bit. And I think that's been not only in relation to health, although COVID has really escalated our consciousness of how triaging works in relation to health. And there's been a whole set of scandals in this country about whether or not there's been an active call to older people, but not only older people, people with learning difficulties, to sign something called a do not resuscitate agreement, so that if you're hospitalized and you're very ill, the doctors can decide whether you deserve further treatment. And there's also a whole additional set of scandals about when do not resuscitate comes into action, because of course that's an interpretation of a stage in the medical process as well. So austerity has worked all too well as an insistent attack on any remnant of universal access to anything. So we already have that horrible landscape, which we already know that. COVID comes in. And I'm not going to say much about this because other people have said, and you've already heard something and you'll hear more, I'm sure. But certainly I think Britain is showing that certain kind of odd know-nothingness and a very uncertain status around what science means in popular responses to the pandemic. Lots of odd conspiracies being shared through different social media, extreme distrust of the state, which seems pretty rational to me. But alongside that means that all voices of authority have a kind of interpretive lens around them. And unsurprisingly, what we see is a very widespread resurrection of very old-fashioned forms of race talk. And I think, sadly, revealing just how resilient a very old-fashioned racialized common sense has been in Britain. I certainly hadn't heard for quite a long time. Just kind of people are happy to tell you this whole kind of almost 19th century trajectory about bodies and contagion, and as if it's true, not because they hate me, but that's the world. And of course that means that everything, all the other stuff that might have been slightly quietened or disguised for a while, all of the irrationality, demarcation, hierarchization and exclusion, is up back with a vengeance, but with a different set of clothes and a different set of justifications. So the things I was hoping that I could raise that might be helpful for other people to think about, if we can talk at all, it's so hard for all of us to talk in this bigger space, is that recognizing the disproportionate impact of COVID-19 on racially minoritized communities in Britain seems to be an enabler of further racism. So in this landscape that's made by austerity, where no one's entitled to anything as a matter of course, and the logic of scarcity has already weaponized us against each other, so that part of the logic of scarcity and no one being entitled to anything is that I must always be sharp-elbowed because there's not enough and there's no way of proving. Not everyone can prove that they can have little there is. That recognition of disproportionate impact seems to be becoming a rationale for further unequal treatment. Part of that is again an extension of the logic of triage. Who is a good risk? Who is it worth using the different vestiges of power, resource, authority to save, to protect? Because once you start to naturalize disproportionate risk as something physically embodied, it's like, well, you know, why bother with those people? They die at that rate anyway. And that can further entrench the process of disentitlement faced by racially minoritized groups. So I think as pandemic logics become increasingly embedded in our business as usual, these processes of risk assessment by racist common sense threaten to erode the rights and lives of those deemed to be at risk. And I'm going to say a couple more things of what I mean by that and hope they make sense to you. So by pandemic logic, I'm kind of saying that the idea that we will all be alert and be kind of assessing risk in all parts of our lives, that risk is a physicalized risk, that contagion is invisibilized, but also kind of embodied, that it might build on former racial common senses, but it also kind of brings up all of this other idea that you can map, you can track and trace if I just had the right app on my phone. All of that comes together into an idea of how in a landscape where things are scarce, where the state says, I don't care about you until you bring me the right paper, and some of you are going to die. Again, for people outside Britain, remember Britain opens this whole lockdown with floppy Etonians saying, oh, I'm really sorry, but a lot of you are going to have to bury your loved ones. Ooh. Yeah, that's literally the formal state response of the opening. But in that landscape, people are already ready to kind of fight each other because they've been set up for a battle to the death. So what has happened is in some ways so boringly predictable, and I kind of think certainly Britain's COVID experience feels like it's putting us out of business. You know, you don't need to be a commentator to understand. Yes, we've seen an extreme over-policing of the racially minoritized under COVID measures. The COVID measures provide even greater impunity for the police because they're quite poorly specified, and there's also a popular panic to kind of augment the state power. We're in the first day after we see the first invocation of selective local lockdowns. I was laughing to Valu before we started that it's my hometown is Leicester. Leicester is the place that's in a selective lockdown. And I thought it was very interesting, for the first time in my memory, mainstream British media, the TV all saying, well, basically it's an Asian town, isn't it? It is kind of an Asian town. And lots of stuff that it's meant to be the first majority minority town and those kinds of things with an overwhelmingly Asian population. And even yesterday, I think this got slapped down quite quickly, there was in some of the coverage a suggestion of checkpoints of people coming in and out of minority neighbourhoods alongside these poorly specified police powers. It seems almost not worth my wasting our breath saying this. You can all understand what it means. Pandemic consciousness really lends itself to the renewal of violent and exclusionary racisms because they're remade as a rational response to the threat of the virus. I think for us, part of it, well, what I'd like to try and think about next is how that understandable fear of the virus seems to be neutralising even the soft anti-racist common sense that had taken some public space in this country. Not that everything had gone away, but there was a space of dialogue around a kind of soft anti-racism. That seems to me that's kind of receding quickly. Receding is too slow, it's kind of galloping away behind us. And so I'm concerned about what is coming next. The data-led segmentation of services with private providers. Remember, we're still crashing out of Europe and there's a particular set of actors who are doing well out of that. So think health insurance, but then extend that model and be afraid. That means that being assessed as of greater risk can easily slide into becoming a risk or an unviable risk for investment. Alongside this, we're seeing already, and I think it can only escalate, in this country at least, a new kind of authoritarianism and freelance violence in the name of risk management. So there's something again about how both actual use of predictive data and a popular understanding of the use of predictive data can be used to strip some of rights or protections. What if suddenly loads of minority neighbourhoods are in perpetual lockdown? That seems like, that could, what's going to happen to the checkpoints then? What kind of credentialism might come into place? And I guess my overall thing that I'd really like to be able to talk to someone about is that how is it that pandemic consciousness, how is it working to erase some previous anti-racist claims? I guess with the idea of like, what must we do to our idea of what it is to make an anti-racist claim, given the ways in which pandemic consciousness seems to re-rationalise, re-justify and re-solidify quite old-fashioned forms of violence and exclusion. And now that's enough for me. Thank you.
Thank you so much, Gargi. That was absolutely great. Okay, so our next speaker is Neera Yuval-Davis. Neera is Professor Emeritus and Honorary Director of the Research Centre on Migration, Refugees and Belonging at the University of East London. And Neera will be discussing COVID-19 in relation to bordering and the politics of belonging. Thank you, Neera.
Good afternoon. Thank you for the first 3 or 4 presenters and speakers, because in a way you have said already a lot of what I needed to say. But of course, because we all have such limited amount of time, we need to say more and build on each other. Recently, Craig Calhoun commented that in the same way that COVID-19 affects differently people who have different underlying health conditions, COVID-19 also affects differently societies and states which have underlying health conditions. And of course, different societies in the globe did not all respond to COVID in the way that the United States and that the UK have responded. The time in which the COVID pandemic has hit the globe and the UK has been a very specific time, historic time in the UK, just after the elections, the post-Brexit elections, the major historical defeat of Labour Party and raising some kind of a socialist possibility of an alternative to the multifaceted neoliberal global crisis, including of governability and governmentality of the people in Britain and elsewhere. What is important when we analyze issues of racism and racializations in Britain and elsewhere is to retain the nuancing and the different histories and forms of racialization that affect different people, even though they affect both of the George Floyd murder and of the statistics concerning the very uneven distribution of death between the so-called category of BAME and other people in Britain. We have in Britain, and I want here to maybe make a plug to the social, the SAHE, Social Scientists Against the Hostile Environment, a group of us that have organized in the last 3 years and have written report and also blogs about the pandemic. And on Monday at 5, we have a webinar on racism, policing, and the politics of surveillance with some fantastic speakers, which I would recommend. But we wrote a report which tried to look at the interrelationship between narratives and discourses and histories and practices of migration and racism in Britain, and to look at the way that the major discourses of racism in Britain have been operating linked to British imperial, European, and nativist constructions in different ways. Of course, I don't have space now to get into a detailed examination of the different form of racialization in Britain, but as even Diana kind of commented at the beginning, we could see different forms of hate crimes, of practices of exploitation, of discrimination within, as Gargi mentioned, the whole discourse and reality of politics of austerity and scarcity. But if anti-Black racism has been found to resonate primarily with imperial narratives of belonging, and anti-Muslim and anti-Jewish racism with European narratives of belonging, nativist narratives of belonging have been found to focus on the figure of the migrant. However, anti-alienism emerged in the early 20th century initially against Jews, and the cultural racism of the mid-20th century was targeted at new Commonwealth and Pakistani citizens. And during the Brexit debate, white Eastern and Central European migrants have been targeted, and other European racialized others. The Roma have become an exemplary form of the figure of the migrant, central to nationalist and nativist narratives of belonging and claim of taking back control. When analyzing racisms in general, and particularly during the age of the COVID-19 pandemic, it is vital to analyze it in the lens of intersectionality, being sensitive to the different narratives of racialization which inspire different kinds of hate crime, as well as different kinds of government policies, internal, local, national, and international and global. And of course, the gender effect of it and the age and generation that already was commented on effects of this as well. Of course, we talked about the differential rate of death between the white British and what is called the BAME category. But it's a bit worrying that often, as was already kind of mentioned, that the attempt of explanation has tended to be some genetic predisposition rather than socio-economic positioning. And what we are having to see here, that we are dealing with issues of exclusion, which has become a major policy of technology, of policing, of diversity and discourses of diversity in Britain. What we see here is that we are talking about everyday bordering, in which citizens are become unpaid and untrained border guards, and they can be criminalized if they don't target or don't find out in a way that many of them are not equipped to, whether or not their employees, their tenants, their patients, their students are legal or not in the country. While many of us have criticized multiculturalism as the previous hegemonic technology to control diversity and discourses of diversity in Britain, at least there was some kind of pathway of settlements and integration, even into a racialized construction of British citizenship. But now it is much more exclusionary. And what we see in the pandemic is a major contestation between, on the one hand, though everyday bordering, which continued to operate during the pandemic, everyday bordering in which, in the midst of the pandemic, Priti Patel publicized the point system of the immigration control post-Brexit, in which all, on the other hand, all those who are the heroes, the frontline key workers, that not only, as was said before, are those who are the primary victim of something which is not supposed to be a war, but saving lives. But what we see is that the COVID pandemic have exposed the parasitic nature of the neoliberal public order, which shows how much not only women or families are the reproducers and carriers of the care of the system, but also the state and the public sector, which was so much starved during the time of the austerity and therefore were not ready to the time of the pandemic. So we have the civic discourse in which all these people are hailed as heroes, and we have the nativist discourse in which all these people say you do not belong and you cannot stay. And even because of the emergency system and the public pressure, we find that some requirement to pay for the health system during the COVID crisis have been limited and suspended to health workers, to other key workers who are not with citizenship regular status. They have not. Yesterday in The Guardian, there have been a publication of the report by the Filipino, what happened to the Filipino irregular migrant and how they have been able not to be, on the one hand, they have not been able to stay home and work, but on the other hand, those who work, their conditions and the precarity of the situation has become much worse. Today, Boris Johnson have moved from Churchill to Roosevelt and declared a new deal. Unfortunately, this new deal doesn't seem to be able to deal at all with any of the issues that I think concerning us. Thank you.
Thank you very much, Neera. That was a fantastic presentation. Okay, so our next speaker is Sivamohan Valuvan, who is an assistant professor in sociology at the University of Warwick. So Valu will be exploring COVID-19 in relation to racial nationalism and picking up some of the issues around bordering, as well as speaking about public health, welfare, and anti-China positioning. Thanks, Valu.
Well, thank you for having me. Firstly, a hello to anyone in the audience whom I might know. in this otherwise opaque den of virtual anonymity. But so firstly, much of what I was intending to talk about is already about racial disposability and so on, has been already discussed with such acuity. So I think I will put that aside perhaps, and I will focus on what is perhaps a rather more speculative angle. I am namely, owing to my own research and recent writing, I'm namely interested in what is happening to the nationalisms around which so much, or rather so much, today's right had consolidated so much of its popular hegemony. And there has been some public commentary that has suggested that the right's winning use of nationalist frames has been somewhat disrupted by COVID-19. And I do think there is some validity in what they're saying. But what I also want to explore, therefore, is how the populist right or the nationalist right might recover this nationalist voice once its terms are adapted, suitably adapted to a pandemic's gaze, or what Gargi has discussed as a pandemic's consciousness. So to start, populist nationalism does appear for now somewhat muted, at least in terms of its recent gains across Europe. Indeed, populist nationalism as an entire form seems somewhat uneasy when having to actually contend with actual crisis, as opposed to those that are only simulated via, I don't know, Eurabia or migrants raiding the collective treasure, or foreign languages running roughshod over dulcet England, or even just, I don't know, even just EU largesse at British expense. But I also fear that this brand of nationalism is only biding its moment, only briefly wrong-stepped by the sudden recourse of public health imperatives, whatever its limits in terms of the deaths and the extraordinary disparities that we've seen. So firstly, in the broadest sense, the pandemic's era does seem conducive for the proverbial, as they're called, the proverbial de-globalists to have their alt-right say, to entrench, in fact, the primacy of the nation state, to engage in protectionist scrambles over select health resources, what some have called vaccine nationalism, but and not least, to retrench the vitality and validity of the border. As regards the latter, consider how COVID-19 offers nationalists, in fact, a winning card to conclusively condemn the peril of human mobility. Indeed, it is quite striking here that even in progressive circles, the need for the border to be closed and policed has become a commonplace reflex. And even to some, this might seem an understandable response in the immediacy of COVID. But I think it is right for us to worry about the wider ramifications of such a sensibility, particularly when the border and immigration has in fact been the central object of racial nationalisms, or at least over the last decade. Secondly, on a slightly different note, a certain civic nationalist cue has also been apparent in Britain in terms of how COVID-19 has been filtered and popularly evaluated. A civic nationalist cue that not only deflects scrutiny of governmental dereliction, which we have in spades here in Britain, unfortunately, but not only does it deflect scrutiny, but it also reinforces underlying assumptions around normative citizenship, as Neera has actually just alluded to. Primers of this were glimpsed, I think, in how, even Captain Tom's admittedly spirited and extraordinarily game charity efforts, but even how that was smuggled into a wider fanfare, quick to invoke the fabled Blitz spirit, or how the spectacle of VE Day allowed for a distinctly British version, of distinctly hammy version of national good cheer amid the cruel and daily call of death. But particularly telling here was how what was, in my opinion, initial concern for the under-resourced NHS and care sector, as expressed, I think, whatever people's doubts, and I think we're right to remain critical, but whatever people's doubts about the initial wave of Thursday night clapping, as there was a degree of concern that was being articulated in that, but how quickly that became reduced to an extraordinarily cheap and patriotic ritual. And such stagecraft prevented the defense of the NHS from becoming a debate, a long overdue debate about public spending, but instead it became a matter of national attachment. Needless to say, this notion of attachment is hardly innocent, laced as it is by an undercurrent of national entitlement as regards resources and provisioning, but also in upholding a sense of melancholic whiteness when picturing the national subject. And it threatens, in my opinion, in other words, an enlarged or aggrandized form of health-oriented welfarism that might be on the cards, but that is defensively indexed by racialized markers of nation. Thirdly, it is increasingly evident that China, particularly given its economic and political threat, is likely to be figured prominently as viral pariahs. Again, already alluded to with great learnedness by the previous speakers, but prominently as viral pariahs, but drawing on those colonial lines of racial peril and Sino-menace. The wider purpose of checking the increased clout of China's market position had, of course, already been previewed in the tariff wars and the technology wars as spearheaded by Trump. But the COVID theme talking about China, some even mooting this most extraordinarily convoluted and tortured indemnity case that they wish to issue against China. But I think this kind of fetid frothing suggests that the Anglo-American reckoning, if you like, reckoning with the power of Chinese capitalism is finally finding its ideal contingencies that it was till now fumbling for. It could even be said, and forgive me another kind of speculative flight, but it could even be said that from a distinctly British perspective, that that anti-EU delirium was in fact the quixotic chimera that stood in for the wider rise of China, where the experience of diminished authority in the global flow of accumulation yields a revengist politics against East Asian influence, compounded by an ethos and symbolism of white grievance. The prospect herein of an intensified protectionism and bellicosity as tied to a reheated xenophobia risks endowing, in my opinion, 21st century nationalisms with a distinctly grand civilizational reference and scope. Equally, again, as the other previous speakers have mentioned, equally, any recall of that civilizational brand of nationalism also comes with its violent street-level proxies or racisms, as evidenced in the multiple attacks across various British towns and cities upon people of Eastern and Southeast Asian origin. So those are the three flanks. To summarize, it is that heady mix of national fortification, then the civic patriotisms that rehearse what we might call white melancholia, but also the specter of China that I think collectively sets the terms for a possible recovery and actually amplification of the kind of nationalisms that we saw foregrounded during Brexit. And I'm not actually sure how much time I left, so I just want to actually clarify some of the caveats here. I just want to state the obvious, in fact, in case there are some amongst you, unlikely as it is, some amongst you who might not be as intuitively averse to nationalisms as I happen to be. Obvious nationalist myopia, of course, remains fatally compromised in the face of pandemics. It not only refuses to contend with the global scale of the problem, but also looks for solutions at the level of national consolidation. It is, in other words, a political project that can at best postpone crises, even as it allows crises to multiply. As observed by the Chuang Collective, I just need to find the quote here, as observed by the ever excellent Chuang Collective, actually, who I can't recommend enough, quote, the destruction wrought by unending accumulation has extended both upward into the global climatic system and downward into the microbiological substrata of life on Earth, end quote. Now, the effects of such, what can we call it, planetary mayhem, scatter, of course, into multiple thickly knotted vectors that no amount of nationalism can inure itself from. Yet, a nationalist rendition of crisis response can only ever place the problem exogenously, can only ever place the problem elsewhere, refusing to acknowledge the metonymic equivalent of the problem as it sits within. Put differently, the crisis that borders and fortifications shape to repel is always already inside. Is always already inside by the sheer virtue and interconnectedness of the type of advanced neoliberal capitalisms that we preside over. Now, at the second caveat, yes, it is always ironic, yes, that nationalisms might intensify just as the problems that it contends with are so indelibly imminent as in global or diffuse. Just like the challenges of climate breakdown, but even just capitals, fleet-footed ability to escape jurisdiction, to escape governance, to escape nation. Just like those two, the threat of pandemics require a radically global, radically post-imperial. I think that's really important, as Koja Karam has outlined in a very good essay in Tribune, but a radically post-imperial scale of accountability, action, and governance. But alas, what one fears is that an already proven history of racialized disposability, not least as accrued through the border, and self-defeating, self-destructive nationalist provincialism might also claim this area or this era of pandemics. I think I got my cue to end, so I'll end there. Thank you.
Thank you very much, Valu. That was a incredibly rich and complex analysis, which we'll hopefully return to and unpick a little bit more later in the discussion. So our next speaker is Vivian Shaw. Vivian is a college fellow in sociology at Harvard University, and she's currently leading a project on how COVID-19 is impacting upon Asian American and Pacific Islander communities in the US. And she's going to help us think through the racial dimensions of risk, as well as bring together illness, mortality, and racism, and how they're affecting different racialized minorities in the US. Vivian.
Thank you so much for having me. Yes, I'm really excited by being part of this conversation, and many of you have already kind of laid the groundwork for what I'll be talking about today. So just to give you an overview, I will be focusing on the discussion of hate crimes as they've affected Asian Americans. I'll probably be speaking less about questions of mortality, but more so thinking about how we can think about these very overt instances of racism and extend that to thinking about other parts of Asian American life, Asian American Pacific life. And also thinking about the template that we have of previous disasters and how they can help us understand what is happening right now with COVID-19. So that's just kind of an overview, and I will just kind of jump in and tell you about this different case and what we are trying to do with the AAPI COVID-19 project. So as many of the past panelists have discussed, since COVID-19 gained international attention, first in Asia, there has been an increase of anti-Asian racism, at least in the US and also in other parts of the world. And even before COVID-19 was announced as a pandemic, there already had been a number of instances of, for instance, people avoiding Chinatowns, people using various slurs. And so researchers in the US have begun looking at this phenomena and have begun tracing that. And so one of the exemplary examples of that comes out of the Bay Area, led by sociologist Russell Jung. So he and his colleagues established a hate reporting center. And so they have documented, as of May, and I had to check kind of the more recent numbers, over 1,700 instances of hate speech. And so now we can expect that that's likely numbering in around the 2000s. And this also does not, of course, include many cases that have not been reported as well. So the Hate Reporting Center is collecting, is provided in multiple languages. So that does kind of allow for people who don't speak English as their primary language to report. And they've also been able to track down certain types of trends, such as women being 2.3 times more likely to experience harassment than men. About 43% of these instances happening in places of business. And about 7%, almost 10% of reports coming from Asian American Pacific Islanders, or AAPI, over the age of 60. And so this has been a major research agenda that has emerged in the wake of the pandemic. So how our research AAPI COVID-19 project enters into this is to think about what are the broader ways, in addition to racism, and interacting with these this kind of apparent intensification of racism. And note, I don't say increase, but rather intensification. How this also shapes other broader social processes in different parts of AAPI life. And so what our project is doing is we are looking at different dimensions: labor and the economy, community-based organizing, advocacy, health, education, family and caregiving, and also online spaces and interactions, and looking at how what is going on as far as this, some people have called this a double pandemic, but I think we can actually think about this as a triple pandemic of, the pandemic itself from a health perspective, the economic instability, and this intensification of racism, how those three different factors are shaping AAPI life. And so I'm going to focus a little bit today on one of them being labor, and talk about how the background that we have as far as past research on the sociology of disasters, and how different, how the economies and small businesses, for instance, were affected by these, to think about how we can use that as a template for understanding how AAPI communities are dealing with COVID. And so we already have, as of May and this summer, the Department of Labor in the US has reported that nearly 3 million people are filing for unemployment insurance per week. And so right now, this brings a total tally of unemployed people to 36.5 million people. So, I mean, it's very clear, this has been widely discussed as far as, it's been widely discussed that this pandemic has enormous economic ramifications. And we can even see, as many of you know, that the economic cost of the disaster is in part one of the rationales that different politicians use to argue that we should, quote, reopen, right? And of course, there are various types of risks associated with reopening, and they affect people disproportionately. But what we're seeing in the statistics is that, as can be expected, it's not simply say white Americans who are affected by unemployment and by these economic ramifications, but people of all different backgrounds. And so some of the numbers out of New York State, for instance, show that Asians filing for unemployment represented a 10,210% increase. And this is compared to, for instance, white New Yorkers whose unemployment filing increased by 2,900%, and 3,200% for Latinx workers, and 1,900% for Black New Yorkers. And so one of the key questions that we are asking right now with our focus on labor is, how is xenophobia exacerbating the economic ramifications of the pandemic and specifically shaping the lives of AAPI? And we also note in that context that about 76% of Asians who had been surveyed talk about experiencing discrimination based on their perceived race or ethnicity even prior to the pandemic. So let's kind of talk a little bit about what is some of the knowledge from the sociology of disaster literature that can help us unpack this and, think about what are the racial kind of dynamics surrounding disasters. And so I think that there are two key principles that I really want to underscore. And the first of that is that disasters are socially constructed, right? And so oftentimes when people talk about a disaster in sort of common parlance or kind of colloquially, people will think about disasters in terms of, say, a hurricane or tsunami, an earthquake. These are disasters. But within the scholarly literature, disasters refer to not only, say, a natural hazard, which is kind of the above categories I just mentioned, earthquakes, tsunamis, et cetera, but also the sort of bundle of everything that happens socially, economically to people, right? And so when we can think about, for instance, how is it that disasters are socially constructed, we can think about how certain communities that tend to house or have more residents of certain racial backgrounds may be positioned closer to, a toxic power plant that then has experiences a disaster, or certain people living along certain coastal communities and having various levels of access to, say, supportive help who can come in to help, address these disasters, or different types of physical infrastructure and things like that. I think one very clear example of this was a couple of years ago when there were massive wildfires in California. Kim Kardashian and Kanye West, who I think many of you are familiar with, were able to hire in private firefighters, right? And so that, even though the area that was impacted, much of it was already quite affluent, that kind of shows how being uber affluent then affects, the ability to deal with disaster and ultimately what the scope of disasters are. And so similarly to that point, disasters are not equalizing moments. And, it's very interesting because in the aftermath of many of these disasters, or in the wake of it, there's often a lot of hopeful, optimistic rhetoric that comes out. We see this, for instance, not only in, say, news op-eds, but also even in commercials. Like a kind of a very common refrain I've seen is hashtag alone together, right? And so, the ways in which corporations and advertisers attempt to, create a rhetoric around disasters is often through this language of we are all affected, we are all together, and we are all united. But as the previous panelists have discussed, this is clearly not the case. And so what we also see from the sociology of disaster literature that helps us understand COVID, but then also raises certain questions about how this particular disaster is different from other disasters, is that recovery from disasters clearly shaped by race, socioeconomic backgrounds, and that relates to cultural capital, the ability to leverage certain types of networks and collaborate and kind of draw from different communities. But also, in the case of disasters such as Hurricane Katrina, these are events to some extent, right? These are events that are discrete, that have a limited period of time. And so in the case of Hurricane Katrina, there was the original hurricane and then several days of flooding and kind of recovery from that. But what we're seeing with COVID is a disaster of a much longer time frame, right? And so when we think about how there's an acute economic shock after disasters and then periods of recovery, I believe that the issue of COVID-19 is kind of raising questions to what extent this pattern will kind of also apply to the present moment, right? And so we can think about how the length of the disaster and the fact that it's not clear when we are going to have, say, a vaccine for COVID-19 is really raising very important questions about how is it that people are going to recover, right? And so there's this context economically, and there are a lot of discussions about what will happen when, say, businesses reopen after quarantine. But what we want to kind of also add to that is how is it that there are racial dimensions to this economic recovery process. Similarly, the research on disasters also shows that after certain types of disasters, such as 9/11, Muslim and Arab-owned businesses frequently suffered from violence and threats, vandalism, and various other types of monetary damages. And so there was an issue of physical safety that many of these people who were small business owners were facing. And this also kind of relates to research that we already see from non-disaster moments, where very often minority-owned small businesses, because they're interfacing with the public so frequently and with much greater density, are often at the front lines of dealing with intensified racism. And then finally, we also see how after disasters, again, after 9/11, there are difficulties for people from racialized, racially minoritized backgrounds, in this case, Asian Americans, to recover financially, because many of them have challenges with re-entering the workforce. And so there is a study showing that Asian Americans after 9/11 experience higher rates of PTSD because many of them had trouble at re-entering the workforce, and also they had smaller, say, cultural networks to draw upon, which made re-entering the workforce more difficult. Personally, I also have this kind of direct experience because this is kind of the story of my father, and so I can talk more about that in the Q&A if that is of interest as well. And so, but what we are kind of looking at to further complicate this picture is that when we think about AAPI and how API lives are affected economically and socially from the disaster, we find that it's really important to disaggregate what that means, right? And so I can't speak to the UK case, but in the context of the US, there are about 50 ethnic groups that comprise the API community, and about 40 languages and different dialects spoken among them. And it's really important to think about who constitutes API, because when you look at some of the numbers, it's very clear that there are huge disparities between them. So just to give you an example, so the Pew Research Center did a study of income levels among Asian Americans and Pacific Islanders in the US, and the median income was about 70K. But within that, you had Indian Americans averaging 100K and Burmese averaging less than 40K, right? So that's kind of a huge discrepancy. And so when we think about how is it that different communities are affected economically, we have to also think about this the massive disparities between them, and disaggregate what it means when you think about Asian Americans. Further, we already have cases that show that there are different places where different Asian American communities are working, and how that affects, vulnerability to the virus. And so one example that comes up, for instance, is a worker who worked at a Tyson chicken factory in Dakota City. Vienge was his name, and he was 69 years old. So he worked at the beef plant for about 37 years, and then died as a result of the coronavirus that had become, really common at that meat plant. And this is consistent with a lot of what has already been reported as how meat packing plants are often seen are kind of emerging as a major epicenter of the virus. We similarly see how certain ethnic groups are more likely to work at certain types of industries. For instance, the Marshall Islands, which were colonized by the US, saw a major migration to the town in Arkansas, Springdale, Arkansas, and many of them working at the Tyson chicken plant there, right? And so 30% of Tyson's workforce in this area is Marshallese, right? And so I think that oftentimes there are assumptions about what types of work AAPI tend to do, and those often obscure these different these different communities that are working more likely in different types of labors. We also see how Filipino American women are frequently working in the healthcare sector, working as nurses, and so these different dimensions shape vulnerability. And also labor is gendered as well, with, as I mentioned, Filipino American women working in as nurses. So I think I'm running out of time, so I just want to kind of speak briefly about how does the present moment help us think about racial politics more broadly, and also Asian Americans and our interrelationships with other communities, for instance, Black communities in the US, and what is this kind of increasing discourse around Black Lives Matters and racial justice, kind of how does that shape us? So I think that there are kind of a few key questions that we need to think about. I don't necessarily have the answers to all of them, but I will say that, my past research was on racial politics and social movements in the context of Fukushima, the nuclear disaster in Japan. And what was very surprising out of that case was that some of the social movements that had emerged after the nuclear disaster, then eventually laid the groundwork for an increase in anti-racist social movements, right? And part of how that came out was, and this is my theory of post-disaster citizenship, is that, you know, the ambiguity around the disaster, the location of the disaster, because radiation is something that can't be felt, seen, etc. This simultaneously produced this narrative of shared vulnerability at the same time that, you know, activists were also aware of the inequalities that led to the ways in which risk was distributed, right? And so, like, activists in Tokyo, for instance, knew that they were not, you know, living next to nuclear power plants and thus were in a relative state of privilege as a result. But then they were also thinking about some of the socioeconomic factors that made it such that these very toxic and dangerous plants were located in, you know, poor rural communities, for instance, right? And so this kind of like set the stage so that when, you know, hate speech became a problem 2 years later, and we can also think about how nationalism, as was mentioned before, often kind of gets stoked in the context of disasters and social crisis. They already had this sort of foundation to then activate and address issues of anti-racism. And so we have this issue right now, I believe, in the AAPI community in the US, in that on one hand, you have this sort of potential for anti-Black racism and discourses targeting you know, other people of color communities, such as Latinx. You can see how there's a potential of a rise of that, right? And so, for instance, I've seen on Facebook and social media, in communities in which Asian Americans are talking about their vulnerability to racist attacks, there's also been discussions about other people of color as you know, potentially perpetrators of this, right? And you see how there have been you know, cases in which, you know, sharing, say, these videos, there have been, you know, some people have responded by, you know, perpetuating various racist stereotypes, right? But then on the other hand, you see how there is this aspiration among another kind of group of Asian activists who are really trying to use this moment to think about how can we create interracial solidarities, right? And so part of that is coming from this legacy and this aspiration that was established from the civil rights in the mid 20th century with Yuri Kochiyama, who was a close friend of Malcolm X, and they kind of worked together for a long time, and she was even there when he was assassinated. And so there are these aspirations within AAPI communities to take advantage of the current moment and to take advantage of this intensified and increased discussion of racism as it affects Asian Americans, to then kind of think more broadly and build a kind of a deeper platform for thinking about racial justice. But it's very complicated, right? And I think it's complicated by the histories that we have of, say, for instance, tensions between Korean immigrants and Black Americans in LA during the uprisings of 1992. It's also, you know, the tensions are coming from, for instance, in the George Floyd case, one of the police officers there was Hmong. And this has kind of raised questions about what are the roles of Asian American and Pacific Islanders in relation to, you know, to anti-Black racism. But just to kind of return to that again, another critique of, you know, these discussions is that, you know, Asian Americans and Pacific Islanders need to reckon with the inequalities within our own communities, right? And how, you know, that kind of also shapes how we think about racial positioning and things like that. So I'll leave there. I think that it's time for me to wrap up, but I look forward to hearing your questions. Thank you so much.
Our final speaker is Colin Clark. Colin teaches sociology at the University of West Scotland and works in Romany, migration and refugee studies. Today he'll be talking mainly, I think, about his activist work on the impact on COVID-19 on Roma communities. Colin.
Thank you, Diana, and Sastape Lachadivis. Hello and welcome. Good afternoon. So I'm speaking to you today from Glasgow, and also this is the of Gypsy Roma Traveller History Month. So every June we have a History Month to celebrate the achievements and the fortitude and the nature, I suppose, of existence of Gypsy Roma and travel communities, the fact that we have endured and survived. So I'm talking to you today mainly not as an academic, that is my day job, as Diana said, but I'm talking more in terms of my role with a non-governmental organisation that runs out of Glasgow called Romano Lav, which in Romanes means Roma Voice. I'm a trustee of that organisation and a volunteer. It goes back to 2010-11 in Glasgow. It was set up by a young Slovak Romney called Marcela Adamova. And through the work, we cater for approximately 4,000 to 5,000 people who are resident within Glasgow, mainly within the south side of Govan Hill, which is an area over the water in Glasgow. There are many current issues that the communities are facing right now that are important to talk about. Firstly, I suppose we need to acknowledge that there have been, unfortunately, there's been fatalities and deaths in the community as a result of COVID-19. So obviously taking a moment to appreciate and respect those sad passings that we've had within the community. But the pandemic has raised and amplified many underlying kind of issues, not least in terms of hate crimes and incidences of hate crimes in Glasgow. So, for example, the most recent event that was not particularly pleasant at all was the deliberate targeting and vandalism directed at a Holocaust memorial that we have established. And this is actually the second time that that memorial has been vandalised and destroyed in a very targeted and clearly sort of racist attack. One of the things that we did as an organisation, and here it's the project workers and the project coordinators and the volunteers that kind of really stepped up, and their efforts need to be respected and appreciated. There was a letter and a briefing paper that went to the First Minister, Nicola Sturgeon, here in Scotland. And what was kind of interesting about this, of course, is that, and what's unique about it is that Nicola's constituency is actually Govan Hill, which is the area of Glasgow, it's about a square mile or so, where the majority, not everyone, but the vast majority of Roma populations from mainly Slovakia, Romania, Poland, Bulgaria, and other countries of Central and Eastern Europe tend to be. That constituency fact has been exploited by different tabloid media, but I'll come back to that in due course. So what are some of the current issues and what are some of the risks and vulnerabilities that the communities are facing, aside from the moral panics? Well, the approach I kind of like to take on this is a fairly traditional social policy perspective in a sense, access, take-up and delivery of kind of services. So if you think about housing, one of the main issues that is not uncommon and certainly not unique to Romani communities is overcrowding and landlord issues, mainly in the private rented sector. Now, if you're living in an overcrowded two-bedroom flat with an extended family, social distancing and shielding is very, very difficult to do, particularly in a densely populated area and geography such as Govan landlords that we've been kind of encountered, unlike mortgages where we've had examples of mortgage sort of holidays. Also, there's been evictions that we're aware of as well that have happened. From a health perspective, thinking about the COVID-19 perspective, here I suppose it's been issues really around language, literacy, education, and the importance really of very clear public health communication messages, and also how different forms of digital social exclusion unfortunately get in the way of that. Many Roma families and individuals are within high-risk categories with underlying health issues, diabetes, respiratory kind of issues, anxiety, stress, tension, etc. And the need to translate very clear public health messages has been really important over the last few weeks and months. And there has been a lack of clarity, and there has been some confusion, and there has been a lot of assumptions, I think, that have been made, and some misunderstandings. So, for example, one of the rumours that circulated in the absence of a clear health message was that COVID-19 could transmit through water supply. So bottled water was being bought in big supplies by many Roma families at an expense that they could ill afford. And that was one example, but there were others as well. Likewise, education, there's some serious issues with education in terms of some of the progress that has been made. Some of the kids, I can't tell you, are making unbelievable progress at school, both in primary and in secondary, and now going through into college and higher education. But we're really worried and concerned that some of the progress that has been made by the kids is now going to be derailed by COVID-19. Again, we come back to the digital exclusion. We did have one bit of success there. There was a grant that was applied for, which we were successful in getting. Again, the project team take congratulations here. We got tablets, we got mobile broadband packages, we got SIM cards that we were able to distribute to families in need from sort of the Romani community. Poverty, instances of poverty have definitely increased over the duration. It's been enhanced and again underlined, really amplified by COVID-19. Stockpiling early on, despite what I said about the water, was not really feasible. Many of the adult sort of Roma population and young adults are self-employed, they're doing agency work. They're not really under the safety net. They've not been furloughed to a large extent. They're not working from home. They're not in occupations that allow for that. However, but many are key workers. But again, there's instances there of a lack of PPE protection, which has been quite concerning, particularly when those individuals are returning home. The impact of welfare conditionality has been underlined, definitely. Also the not just the emotional, clearly, but the financial impact of bereavement has been really felt by certain households, and young families in particular are very much in need. In terms of racism, people I'm sure will be aware, indeed some of the panellists have written about this, and I'm sure some of the attenders have written about this and know about this too. The Romani community has impacted, the impact of structural and institutional racism across different parts of Europe has been a historical and contemporary reality. COVID-19 has really enhanced that, particularly under the guise of heavily influenced sort of police monitoring and surveillance techniques, very-handed cases in some regards with some of the camps, particularly in Greece, Hungary, Spain and other countries. The European Roma Rights Centre has very much been following this. We've seen physical attacks, we've seen hate speech evidenced. And in the UK context, I think what we're actually seeing now is a double whammy, at least a double whammy of Brexit and COVID-19 kind of coming together. The newspapers, the media in particular, The Sun, The Telegraph, have really gone to town on this, unfortunately, and have highlighted cases of alleged examples of the breaking of social distancing rules, having barbecues in backyards, and sort of camera phone footage kind of showing this allegedly. Also, there was footage circulating of Roma kids spitting and coughing allegedly on people passing by in the streets, which turned out to be, of course, not actually true. And I suppose what the work that Romano Lav has been doing and what we're seeing here is that it really does put paid to the mythology of this idea that the virus does not discriminate. Of course it does. We've seen deaths, we've seen hate crimes, and we've seen the amplification of underlying institutional trends in Govan Hill and indeed elsewhere. And unfortunately, many families have chosen to vote with their feet. We've seen examples of extended families hiring minibuses, vans and cars to try and travel back to Romania and Slovakia and other countries. And hence what I was saying earlier about the Brexit, Brexit by the back door almost in a sort of sense, which is really worrying. And so it's examples of racialized stigma. And again, to tie that together, what we've also seen amongst the families who have gone back to Romania, they've come in mainly through the Hungarian border, and that border was shut for a time. But once the Romanian Roma families got back into Romania, they were of course castigated by their own media as the disease carriers from the UK. So again, it ties in with an earlier paper there about this idea of disease containers and disease carriers, and that was very much evident in the Romanian and the Hungarian press as well. Hungary, of course, has its own issues, as we know about. So really four key points just to finish. One, We've seen the sustained support, we need sustained support for NGOs at the grassroots level to try and ensure that communities are assisted who are under threat and in some danger. Secondly, there needs to be, I think, more reporting of hate crime. We need to stay on top of that. We need to monitor the responses and the follow-ups that are taken by the agencies of the state. The third point, I think, is around moral panics and rumours and clear communication messages. We need to directly challenge some of the lies, and that's what they are, that are being perpetrated by the media to try and increase racial tensions, often with political motive because of the constituency area of Govan Hill and Glasgow, as I said. And then lastly, I think we need to see social policy in a very holistic sense here with services. We need to look at the responses and the challenges that COVID-19 has brought with it that explicitly recognise the racialised dimensions and the discrimination that's evident there, to try and reduce the impact of that double whammy that I mentioned. That's me. I've tried to get through that as quickly as I could because you've been very patient, and I just want to say thank you, and I'll pass you back now.
Thank you very much, Colin, for that fantastic presentation.
Hello and welcome back to everyone. We still have a sizable audience, which is wonderful. Thank you very much. I think that Diana and I have learned that having such a large number of amazing speakers who have so much that is interesting to say, it's very difficult to cram everything into a short space of time. And as a result, we have only about half an hour left for the question and answers, but we have some very interesting questions. So if our panelists wouldn't mind sharing their camera with us, then I can start to address some of the questions from our participants. I would like to begin with Matienge first, since she was interrupted, and then I'll turn to Naira. The question that I have for Matienge from one of our attendees, I'm sorry, I'll try to find the name in a moment, is could you please finish the point that you're making? And also, why do you think that eliminating racial inequalities is particularly important for a post-COVID economy? That's for Matienge. Matienge, you're still muted.
All right. I created two faux pas, or caused two faux pas. One is going over time, and then two is speaking while muted. So apologies to my panelists again for going over, and then apologies for just speaking while muted. So I was actually wrapping up my point. So there wasn't much else left for me to say. Other than that, I think that what we can do is just try to contextualize and connect the dots between the anti-lockdown protests, the protests for Black Lives Matter that are happening in the US and globally, and how states are responding to efforts to try to change the racial status quo versus those that seek to hold up the racial status quo. And then we can take from that what is being valued by states and by state actors. And I think that those things sort of speak for themselves. And so my presentation was really just trying to draw out how not only just the current state of racial health disparities globally and the historical racialization of diseases is playing out now with the COVID-19 pandemic. And so that leads to the question that was posed around why is addressing racial inequality so important for dealing with COVID-19? Because I think of COVID-19 as exacerbated by racial inequality, right? COVID-19 shows and depicts how the disease is not one that is impacting, as all of my co-panelists have said, all groups similarly, and is actually exacerbating racial inequalities that exist in society and showing the cleavages that exist in society globally. And so thinking about responding to COVID-19 without addressing racial inequality and racial health disparities and systemic and structural inequalities is something that is a non-starter. I mean, the disease is able to have this disparate impact on the communities that we've mentioned because of this underlying social and structural determinants of health that have made it such that people of color are placed in marginal positions in societies, and those marginal positions exposes them to higher risk. And so if we're interested in fighting the disease, and I think a number of us are, just for self-interested reasons, right? You don't want to get COVID-19, then you have to be invested in racial justice and racial equality, because there is a way in which, yes, we are all touched by the COVID-19 pandemic, but the disparate impact that racialized communities face is one that endangers all of us, and is one that calls for mutual obligations towards others outside of our whatever our perceived group is, in ways that are quite profound, and it calls for just increased solidarity. So I'll stop there before I go on, and I can go on, so I'll stop.
But it's all great. Thank you very much. And that question was from Gargi, but not our Gargi, as far as I know. The next question is for Naira. And the question is, could you comment on the very real possibilities, and I guess this applies as much to the US as to the UK, the very real possibilities of localized lockdowns of ethnically or racially marked neighborhoods, and the questions of bordering and racialized citizenship? That one is for you, Naira. Thank you.
Thank you. Nira, not Naira, but it's okay. I think, I mean, Gargi already commented that Leicester is already being constructed as the Asian city, as the coronavirus was constructed as a Chinese virus at the beginning, and so on. And of course, any kind of signifier can become a racial trope, as well as, of course, a issue of politics of surveillance, as well as the politics of racism. But I want to comment here about this issue of the politics, that again, some of the paradoxes of the politics of bordering and surveillance. I mean, I myself, due to my age and health, have been bordered at home and my local community and park already for 3 months. And obviously the fact that we are all kind of contained at home in the local community when there is high rate of virus has been very important, and of course have had positive positive functions as well. However, if we look locally and globally, what is happening with these issues of bordering and surveillance, we see how this bordering have been used to erosion of democracy in so many places, both in terms of decision making, but also how tracing has been done in a variety of regimes all over the country. And what I consider to be in some way the most dangerous prospect of that, I mean, Boris Johnson is proud always to say that he's going to host this international conference about the cooperation about the vaccine, which of course in many ways is very good, unlike Trump that just wanted to patent the vaccine just for his own use, definitely not even probably of all the Americans. But what we see under the COVID thing, and Bill Gates, and whom Boris Johnson was very proud to mention as one of the main attendees of this conference, is that we see a coming together of the political surveillance and the commercial surveillance. And one of the things that happened in Britain, that Britain left an independent kind of app and joined the Apple and Google app. And what we see is that while political surveillance have been very much attached to nationalist bordering, and until recently, or cooperation like in the EU, Fortress Europe on the one hand, and on the other hand, we have this commercial profiling that anything that you mention in email or even speak near your smartphone, and then you get the ads in through keywords. Now they're coming together. And we know that the ideal for Bill Gates would be that everybody in the world would have some kind of a microchip in which the personal data as well as record of vaccines would be there. So suddenly it will be the ideal of global neoliberalism of borderless world, which in a way would be personal bordering
Internalized borders.
that nobody else have experienced until now. Yeah.
Thank you, Nira. I'm sorry if I
Very
continue.
dystopic. Hopefully it will not arrive, but this is one of the prospects of development.
Thank you. Colin, I wonder if, since these kind of, the dangers of this kind of racialized, ethnicized lockdown must affect the communities that you're working with, if you'd like to say something on that?
I mean, not really, to be honest. I mean, I think I've kind of covered and said what I needed to say. To be quite honest, Lisa, and I don't want to cut into other people's time too much. But just to say that, I suppose, I mean, it's an ongoing, everyday concern. And you know, Romano Lab is a very small organisation. We rely on donations, some money from the Scottish Government, and again, I suppose I need to wave a bit of a flag here. The People's Republic of Scotland has taken a bit of a different course than other parts of the United Kingdom, particularly our southern neighbours. But having said that, it's not been that different, actually. And as I say, we have a situation just now whereby families are, for the second time that I can think of in recent history, we have families of Roma from Central Eastern Europe who are returning to Central Eastern Europe because they feel safer in Central Eastern Europe than they do in Western Europe. The only other occasion I can think of this happening was around 2007, 2008, when some, again, it was Romanian Roma Calderaș families who left Belfast to go back to Romania because of targeted violence, which was based on a fundamental misunderstanding that the Romanian Roma were Catholic, when of course, you know, they're not, they're Orthodox, they're Greek Orthodox. So there was a misunderstanding in loyalist sectarianism. And that's the only other occasion I can think of where you had that strange situation of, that anomaly, really, I suppose, of families moving from west to east. But no, it's an everyday thing. And the organisation and the project workers are working really hard to try and minimise the pain and get clear messages across. I think it's the communication that's been so important.
It's great. Thank you, Colin. There's a question now for Gargi, which is, and it actually builds on a couple of different questions that have come in. One was a comment about the way in which BAME communities and disabled staff are working together. And there was a question then about the danger that the workplace guidance that's currently going out with risk assessments for vulnerable groups. So this comes back to what Nira was saying. How is it possible, Gargi, do you think, to avoid these becoming exclusionary?
So even here, I've got a trade union question. But okay, let me try and think about that. I mean, I do think, you know, you can hear that's my concern, that the combination of a kind of popularizing essentialism of both racialized identities and disabled identities is already leading to an entrenchment of inequalities that are already in our workplaces and sadly in every workplace that I know of in this country and beyond. As always, the only answer I ever have for that is we need to mobilize collectively. There isn't a technique around that, because there just isn't. But I do think it's important for those of us of goodwill to say that to each other, because the combination of panic and over haste is making good people get kind of bought into a kind of risk assessment as if this body is the risk. That's happening in my workplace. I think it's happening in workplaces across Britain right now, given this kind of be alert kind of system. And it is kind of important for us to speak to each other about what it means to challenge that, but not to be a a Boris-like libertarian, because I think that political space it's willfully being closed for us, isn't it? So our job is to open it in order to, that's all, you don't need to invite me. I'll always say at the end, and now we must mobilize. I'm so dull. It's not worth the time, is it?
Thanks very much, Gargi. And there's a question here for Vivian, which is, well, actually, it's in a couple of different parts. I'll just read it out. How do we focus on the experience of the person, that person who might be from a marginalized background, when the positions in literature are on different ends of ontological and epistemological positions? I think it's a she, it's Bhavna Sen is asking whether you have any advice on arguing an epistemological position as an academic. And then if that's okay, I'm going to come back to a question for Siva Mahan, and then a final question for all our participants before we get shut down. Sorry, Vivian, go ahead.
Yeah, so if I'm understanding the question correctly, and it's too bad because I would normally be, oh, can you clarify that more, but given the space. But if I'm understanding this correctly, this question is, how is it that we understand marginality within a context in which there's already kind of an epistemological marginalization, right? And so I mean, maybe similar to this question of, how does a subaltern speak, and then kind of how do we research people who have been excluded from these narratives? And I think that's very important because I'll give you kind of an example. So the case that I mentioned with George Floyd, where one of the police officers is Hmong, there was a lot of discussion about that because after this incident came out, a lot of Asian Americans communities were discussing how we need to kind of think about ourselves and kind of do a calling in as far as how do we kind of perpetuate anti-Blackness within our own communities. And one of the critiques that came out of that is yes, and so that was that yes, Asian American and Pacific Islanders need to think about how anti-Blackness exists in our communities, but at the same time, what is the sort of positionality of focusing specifically on this Hmong American, right? This person who is coming from one of the most disadvantaged Asian ethnicities in the US, where as far as socioeconomic and career trajectories maybe look very different from East Asian immigrants, right? As far as what types of education, educational attainment, in terms of what types of jobs, and so for instance, maybe I come from a Taiwanese American background, and fewer of us are, say, involved with police enforcement, right? And a few of us go to the join the army and things like that. And so that was a discussion that came out as far as what happens when there are these very class sorts of dynamics as far as who is often in these positions, right? And how do we call in without sort of reproducing these kind of intra-Asian inequalities? And so I think that is, I think that's a key question. I don't necessarily have a solution for that other than being very explicit, right? And one strategy that we're using on our team, because a lot of these, the researchers that I recruited on this team came out of my personal, professional, and social networks, many of them happen to be East Asian, right? And so we realized very early on that that is very problematic. And so we are kind of working to develop this advisory board type structure where we can bring in researchers who have more experience working with certain types of populations, and they can advise us without us then creating like labor for them in a problematic way, right? And so I think that part of this involves being mindful. It involves being reflexive, and this is kind of very key for doing ethnographic work, for instance. And so I think that being reflexive on multiple levels is kind of just what we need to correct some of these epistemological exclusions.
Thank you very much for that, Vivian. What I'm going to suggest, if you don't mind, is I'm going to just throw out 3 questions that have come in from all of the attendees, and then go to each of you in turn, asking you to respond to whichever of the 3 that you would like to. So the first question is from one of my postgraduate students, and it's an important question. It's, what do you think has been the role of the media in all of this? Then there is another question, which is about Elsevier, the publisher, and the demand on CEOs to take an explicitly anti-racist position. And then the final question that I'll throw out to you is from a colleague from Sarah, asking about the role of academia in all of this, and also for some self-reflection. Here at City, we have an ongoing discussion about changing the name of our business school, which is called after a slaver, Sir John Cass. So Neera, if you don't mind kicking us off with whichever one of those you would like to address, or all of them.
Okay, I will start with the third question, because I already talked about our group as a social scientist against the hostile environment, because we felt that as social scientists and as academics, we have very special role in order to fight against these issues. We also published a statement, again, you'll find it in our website, but we also distributed, of solidarity with all the fighting against anti-racism. There's been a lot of talk about decolonizing the curriculum, and of course, which involve not only confronting the colonial and imperial past, but also decentering the Westocentrism, including of racialized minorities, in the whole kind of discourse, because the situated gaze of colleagues from the global south very often is very much missing in all this. But I think, though, that we have to look at all the cultural politics and all this campaign within the context. Somebody mentioned about the whole campaign of against statues and throwing down statues, and also we have in our university about the naming of our school on these grounds. But you know, I never knew or forgot that the payments of compensation to slave owners in Britain finished only around 2015, and it's not just and this is a basis of wealth of people who are sitting in the House of Law, the hereditary ones that are still, I understand, are more than 800 of them, and there's 31 dukes, I learned the other day, and the whole kind of structure of the distribution of wealth, especially land and properties in especially land, I think, in Britain. So I think the role of academia is both to lead our to lead the struggle within our whole field of employment and education, but also to remind everybody the overall structural and historical context within which all these struggles have to be carried out.
Thank you very much, Neera. Siva Mohan, I have a quick question for you, and then you can choose which of the other that you would like to speak to. And it was in relation to a term that you used, which was vaccine nationalism. And one of our attendees asked, since we're so busy looking for a vaccine for COVID, what do you think are the chances of finding a vaccine for racism?
Yes, so I think it's already been covered fairly well, but some of the more protectionist measures, particularly from Western nations, has been initially the more high-profile form was when Trump did a kind of scandalous, but I think it was a lot of bluster as much as anything else, of trying to monopolize a lab in Germany that might be able to develop a particular vaccine. Again, I think it's more about the fanfare of his media positioning than anything that was particularly plausible as such. But obviously that kickstarted from within the Western form a certain anxiety about monopolization of resources. But of course, it speaks to a wider truth, which is much more embedded in global inequalities and Western, or at least the privileges of certain governments. And so one thing that has obviously concerned all of us who come from a kind of post-colonial setting or post-colonial training is that even the discussion of shared vulnerability and the crisis, not only is it internally demarcated by racialized stratifications about whose value matters and who invites pity or solidarity, but even on the broader scale, there's been a lot of retrenchment of resources. There's been a redirection of resources towards COVID, in fact, which in fact has exposed global South countries to rely on some of those raw or core materials and medicine for the address of other diseases or other health needs that are much particularly or equally acute or imminent. So I think it's about the wider play of resource concentration, the ability of powerful states to foreground their own national communities in terms of how then it redirects global resources. And of course, how the private sector is implicated in that. So it's not merely a nationalist question, it's a question about capitalist distribution, as Mike Davis has spoken of very well around the pharmaceutical industry. I think the second element you mentioned was, I actually think, I mean, the question picks up on a very imaginative way in which Black Lives Matter in particular has been able to foreground this idea of two pandemics. So it's been a winning kind of, and it's a raw kind of, has a rhetorical resonance. But of course, it speaks to the fact that it uses the immediacy of COVID, and for all our criticisms of how COVID has been mediated, it does allow for a sense of shared vulnerability. And then Black Lives Matter, certainly in both the United States and Britain, has been able to leverage that sudden attentiveness to the value of life back to the stratification of the value of life, or rather premature death, as of course Ruthie Wilson Gilmore has spoken of very well. So I think in that rhetorical sense, it's been a very powerful wedge. And I think the very fact that all of us and so many people have dialed into this webinar suggests that there is a heightened attentiveness that is, of course, symptomatic of what COVID has opened and allowed for more radical assertions from within.
Thank you so much. Matienge, are you okay to choose which of the questions, the final questions you'd like to respond to? Thank you, Siva.
Yeah, thank you for that. Yes, so I think I'll take maybe both the role of the media and the role of the academy in turn. And I think there are two things that I want to say related to the media. One is that there's been a backgrounding, I think, of sort of particularly in the United States, of the ways in which COVID-19 has been experienced. And so recently, I think there was the New York Times front page basically that just listed the names, right? So there's a way in which COVID-19 and the pandemic has been rendered invisible because you don't see, rightfully, you're not getting access to people's funerals, you're not getting access to sort of hospitals being overrun because of privacy concerns and other things like that, but you're not seeing the devastating toll that this disease is having, and that's on a national and I think also global level. And so there's a way in which when you see numbers, they can become statistics. And so there's a way in which there's a depersonalization of things, and that also plays into some sectors which view this as sort of fake news, right? That the pandemic is not actually as bad as is being made out, and that this is hysterics and other things like that. And so there's a responsibility, I think, of the media to render the pandemic and the disparate impacts that it's having racially real, and to concretize that by telling more personal stories and the like. And I think that the role of the academy has been highlighted in such social media campaigns like #Black in the Ivory. And there's a way in which calls for decolonizing the curriculum, calls for re-examination of the prioritization of race and the law, for example, because that's my area of expertise, but race and the study of race as something that needs to be reprioritized. And I think I want to just say briefly that it's not just about thinking about studying race, but it's also about reconceptualizing race and moving away from thinking about racism as something that is personal, that's something that is related to having prejudice or negative associations, because then conversations in the media, in the academy, then degenerate into strong claims and counterclaims about whether someone is a racist, quote unquote, or what is in somebody's heart, and whether you know that they have this mental quirk of racism. And so this racism as psychological censors the individual attitudes. It obscures racial stratification, racialized social systems that are based on the devaluing of people of color, and it focuses on racism as pathological and creates individual caricatures. And that's seen in the media. That's also seen in how some in the academy view racism. And so then the point is to distinguish yourself from the archetypal non-racist person, and then to distinguish yourself from the bigot. And so that draws attention away from, again, social structures, stratification, the ways in which racial inequality is a systemic and institutional problem. And so I think the work to be done in the academy is to move away, and there has been work already done, obviously, to move away from thinking about racism as a baseless ideology, to thinking about racism as more macro structural processes. But there has to be much more work done to translate that into media and into sort of the general public understanding of how racism furthers hegemony, power and dominance in a way that is not about sort of individualized, conscious behavior of biases. So I'll stop there.
Thank you so much. Gargi, you and then Vivian, and then we're wrapped up, I'm afraid. Gargi.
Okay. Again, I always say the same thing, don't I? I'm sorry for everyone who's heard me speak before. One of the things I think happens in any moment of political rupture and opportunity is that those with power learn pretty quickly how to find ways of containing the possibility of limiting the space of action, and most of all, engaging us doing some quite small things while the real violence is then mutated to come elsewhere. I think the moment of pandemic, which I was saying in a very garbled way, is reopening a very familiar and yet remade set of racialized violences and class violences. They're not even hiding them, because they don't need to hide them from us, because our political languages of resistance are not yet up to speed with what those things are. I think they are in some bits, but not in others. So I think the job of academics, as always, the job of academics is just try not to be an arse, try to carry your weight, try to be a moderately good neighbour, citizen and colleague, and use your expertise just as anyone else would use their expertise to say, what is the terrain we're all fighting on? And I think one of our key insights is to say, yes, there's a long legacy of violence and that's still happening, but at the same time, they're coming round to get you from behind. And there's some of our skills which can tell us, our colleagues, comrades, neighbours, not only this, but also the coming round from behind, because we're dead otherwise. Again, another miserable ending. Thank you.
Thank you for that, Gargi. Thank you very much. Vivian, I'm turning to you in the end. Is there one
great
issue that was raised you'd like to address?
Well, I think we can just end on saying don't be an ass, but I can speak a little bit more than just that. I guess I'll talk a little bit about academia and corporate positions. And one of my colleagues, Katie Rogers, who's a PhD student at the University of Texas at Austin, recently kind of wrote a piece about how there is a fundamental contradiction between corporate claims of anti-racism, because most of these corporations are already invested in racial capitalism, which is thus perpetuating these systems of disempowerment and violence. And I think just to add to that, I think, part of how I have been theorizing crisis and disaster through the concept of post-disaster citizenship is how in these moments of crisis, there does appear to be a certain type of political opportunity that people, latch onto and use in order to mobilize and kind of push forward certain types of positions. But part of that process then also has the other side, which is that, as we know, COVID-19, police brutality in its current form, we're not necessarily, or George Floyd rather, these were not the first times that, racism emerged, right? It's not that racism is suddenly anew, right, in this moment, but rather there are certain types of moments trigger a type of discourse and attention to racism and racial politics. And so I believe that I don't want to be entirely pessimistic about crisis as a moment of opening up certain types of discourses and types of awarenesses. But I think that something that needs to get looked at is how the other side of that is how, as perhaps say people who have enjoyed certain types of racial privilege or kind of certain positions of power become more aware of racism and then kind of take on this role of speaking for anti-racism or kind of participating in these different types of movements, there is the other side of why is it and what do we do about the fact that many marginalized communities have been working on these issues for a long time. And so I think that we see that both in the context of protests and kind of the physical forms that as it happen in streets and things like that, but also in academia. And so I know critique that has come up because there was recently in the Chronicle of Higher Education, I don't know if you also read that in the UK, but there was recently an article in the Chronicle of Higher Education saying that professors need to start teaching students about racism and racial structures. And this irritated a lot of people who have been working on this issue for a long time, right? And so I think that we need to think about if we are kind of like going to pivot and kind of intensify academic attention to these issues, which is not necessarily a bad thing, how do we do so without then reproducing racism, right? And so like what is going to happen when people who are not necessarily experts in looking at racism then kind of become the spokespeople for kind of disseminating this new knowledge? How is it that as they take on these positions, they may then kind of draw from the labor of people who have been speaking out about this for a very long time? And how is that disproportionately racialized, gendered? And I think those are some of the questions that we need to think about, right? And so it's a back and forth. And I think that for me, that is what crisis reveals, this tension by which certain types of, politics come out into the open and kind of burst open and become very apparent. At the same time, there is this kind of burying of labor that has kind of long existed.
I think that's a really important point to have made, Vivian. I think certainly in our own institution, we're seeing how certain groups of people are being expected to do the heavy lifting on certain issues. I'm going to turn to Colin for a last comment, and then I will hand over to Diana to say thank you and goodbye. Colin.
Okay, just 60 seconds, and just to cover the media aspect and then the academy sort of aspect, really. And it would be, I think, really remiss of me to not mention that we had a terrible, terrible event happen in Glasgow on Friday, which involved stabbings at a hotel that is currently being used by the mayor's group to house asylum seekers. And the terrible events there were framed initially by the media as a terrorist incident, and the far right mobilised around that and made an awful lot of noise in what was an incredible tragedy for the city of Glasgow and elsewhere at that time. And what that underlines for me, I think, is the need for both us, advocate scholars, however we see ourselves. It's about holding ourselves and others to account. We need to make use of the bodies and agencies, both within government and outside of government, to hold each other and to hold people who wield power to account. So I come back, I think, to the mobilisation issue that Gargi kind of pointed to. And I think that a sense of real advocacy scholarship as well is urgently required, I think, within the academy. I think through REF and other instances like this in the UK, we have completely lost sight of why we came into this job in the first place and what we're trying to do here. And I think that's what I would probably end with. It's about holding power to account as ever.
Thank you so much, Colin. I'd like to extend my personal thanks to all of you, especially for your rallying cries and your challenging of all of us in academia to do better and to keep up the fight. Diana, I'm going to hand over to you. Thank you.
Yeah, thank you so much. I just wanted to make one final last comment about the role of universities in all this, and the way in which we've seen all sorts of institutions, as well as in universities, coming out and proclaiming that they're standing in solidarity with those who are affected by such racial injustice, and when their track records have been and continue to be anything but progressive. So I just, wanted to mention one of the question that came up actually phrased in terms of the university question, was phrased in the lines of City, who has been very slow to take action over our business school, named after John Cass, a major figure in the slave trade. And at the same time, obviously City was another university who came out in support of Black Lives Matters. And at the same time, the very same couple of days when they came out with this statement, one of our very much loved friends and colleagues, Andrew Boateng, and his 13-year-old son, you may have heard about this in the news, was grabbed by officers and threatened with tasers while he was actually on a charity bike ride after being wrongly suspected of involvement in a stabbing. So I just wanted to kind of bring those three things together to kind of think about, how much work we've got to do in universities, and how much, hopefully, going forward, we will continue to have these conversations that begin to, as Colin says, sort of ask our institutions to really confront some of these major issues head on. So I would really like to thank all of our speakers for wonderful, wonderful contributions.